Welcome back to VME Vaginismus, Let's Name It Not Shame It. I'm Audrey Cairo, and yes, we're back with a new episode. And while it's taken a while, do know that this one was definitely worth the wait. As the previous episodes, I really hope to bring you some knowledge or findings from professionals. And as I felt we needed to continue to discuss our pelvic health, I cannot tell you how happy I am to share my conversation with the amazing Clare Bourne. Clare is a pelvic health physiotherapist, and as you know, I am a big advocate for anything to do about you learning more about your body, and she's the perfect person to speak to. Clare and I discussed what you could expect when seeing a pelvic health physiotherapist. We discussed dilating, body image, and our amazing book, Strong Foundations: Why Pelvic Health Matters, an empowering guide to understanding your body. I really loved my conversation with Clare, so I hope that her findings will give you some insights too. As knowledge is powerful, stay curious and have a listen and let us know what you think. Good morning, Clare.
Good morning.
I'm I I have to laugh at myself how I always start. I'm always thinking, I'm so excited. But again, I am really excited to get you on this call. How are you this morning?
I'm good, thank you. Yeah, no, I'm really well.
Yeah, like I think we both rushed to get to make this work today. But I really feel like there's so much that I want to talk to you about, and I'm not sure if I'm going to have the opportunity to get all the questions there. But as a pelvic floor therapist or pelvic floor physiotherapist, do I say this right? Like you could
Yeah, absolutely. Yeah.
so, as a pelvic floor therapist and a pelvic floor physiotherapist and a writer as well, we have a lot of grounds to cover. But before we go to any of your knowledge, I actually also feel that it will be great for people to hear who you are a little bit. And the way that I normally do it is to actually start with kind of an open question, which I always am curious about. Just to maybe ask you first about if you can give one word that would describe your current relationship with your V, what would it be?
Oh, yeah. Empowered, I think. I think I've got so much knowledge that I feel like I'm probably at an age where I really understand things, but I also work really hard to look after it.
Yeah, yeah, like I can imagine that. Like you've got all the like a library full, likely,
Indeed.
of all the knowledge and your interest itself. Um, so if we then think, because of course, as empowered, like you, I always feel that sometimes people get to these professions with a specific interest. So can you tell me a little bit more about how you gotten to become a pelvic floor therapist?
Yeah. I mean, I went into it actually as my first ever job. So it wasn't actually through any of my own experience. It just happened to be the first job I was given when I graduated university, and you kind of go through the process of doing all specialist areas. Now, it was unusual at that point for a junior physio to work in this field, but they were sort of trialing, can we get more physios into this earlier on, because it's a really growing field and it's really important. So it wasn't through experience, it was just through, this is your job, love, get
Oh,
on with it. And I was like, oh no, I don't know anything about this. But then from there it built, and it was, yeah, I just fell in love with it. I thought it was amazing.
so for people who don't know what a pelvic health therapist is or does, could you give us a little bit of an idea about what it is?
Mm. So it's a really broad job. And actually, I think for everyone, it can look a little bit different, because some of us will just treat females, some of us will treat female and male, some of us will treat all genders, some of us will treat all ages. So it can be really mixed. I think most commonly, you will see physiotherapists who look after females who have a vagina, a vulva, and supporting them with all host of symptoms, really to do with anything in the pelvic region. So this might be relating to their bladder, their bowel, their sexual wellness, general function around the area, returning to exercise after having a baby, any pain. Like, it's a broad area, because there's so much that happens in the pelvis.
Yeah.
Like, there are the pelvic floor muscles, but really the function of that is related to so many bodily functions and conditions that we can treat. So it will be broad, and lots of us have then specialist interests within the wider area. Some may work more in sexual health, some may work more in the bowel digestive health. But generally speaking, we can all do everything, but we might then just develop more specialist interest in one area.
Yeah. And what is your specialist interest?
Yeah, do you know, I still feel like I'm a bit of a love it all, but I would say now, I mean, I love the sexual health side of stuff, sexual wellness. For me, there's just nothing better than working with a woman who's feeling just so demoralized. You know, maybe relationship issues are coming in, wanting to have a baby, but maybe struggling to have intercourse, like so many factors, and being able to support that person and meet them where they're at and then journey with them. It's a massive privilege, and it's something I absolutely love doing. I work in a specialist bowel team, and I really love postnatal recovery and supporting new mums to recover. So I think if I had to pick three, those would be my three.
Those were three. and the thing
I can't pick one.
No, and that's fair enough. Like, I think that's the same for me. If I think of, like, if someone says, who do you want to work with? But there's something about, like, what you say, supporting women in this journey. And also a very undiscussed, I feel, topic.
Totally.
And like, maybe for the listeners, it's a bit of I am maybe a bit of a broken record, because I have said this multiple times in the podcast. But so when I was going through vaginismus, or when I found out about it, I found out about it through a pelvic health therapist. But this is now 20 years ago in the Netherlands, where where she was for me like a lifesaver, in such a sense that I learned so much about my muscles, and how to use them. And even if it wasn't that vaginismus all of a sudden disappeared, because the spasm, of course, was something I had to learn to manage, and to understand myself. I felt like when I came to the UK, this is a long time ago now, but I felt that the conversation about pelvic health wasn't as loud as it's becoming louder and louder now.
Yeah.
I think maybe because of social media and us having these types of conversations, where I really felt like, hello, people, like, why are we only thinking about therapy in the sense of our minds, where it's all together, where it has to be so many different things together to also know our bodies, right?
Totally. And
but
we are one body. We are one body. And though we have a healthcare system that separates us, and we're not really brought up to understand that, like, it's the foundation for me of just human being. It's weird that we've got to this state, I think, in society, where it's almost like mental health is such a massive topic we've got to talk about, as it's this humongously separate thing, without an understanding how our mind and our body are literally talking all the time. All the time. I mean, it's like amazing, but equally still felt very weird to discuss.
Yeah. And it's easy to ignore something that you can't see.
Totally. Right? Oh, 100%.
Yeah. Yeah.
And it's still taboo or shameful, or we shouldn't be talking about, or things like that.
Exactly. So, as I already mentioned, the word vaginismus, like, of course, this podcast is all about trying to empower and support women who either are being challenged with vaginismus or any other conditions that are similar or feel similar as well. But I want to check with you, like, what does vaginismus mean to you? Just from your profession, what it is what you believe that it is, because it's always interesting to hear different professionals talk about it from their perspective.
Yeah, so vaginismus for me is where the pelvic floor muscles respond to penetration. So they often tighten and contract at the moment of penetration, whether that be intercourse, a smear test, self-pleasure, whatever it might be. Now, this can be associated with pain, but dyspareunia is the term that we would use for, say, pain with intercourse. That might be caused by vaginismus, or there might be other causes, but it's very much a response of the pelvic floor. And I describe the pelvic floor a bit like a bodyguard. It's there to protect us. And sometimes it can be a learned response, or response that comes out of nowhere, either to having had a painful experience, or the anticipation of a painful experience, or something that maybe was not as consensual as we'd felt it should have been. So it can come out of nowhere. It can be something you have from very, very young. But yeah, it's this response. But I think it's also important to say it's often not a conscious response. You know, I think this is where we have to understand the pelvic floor. We can consciously contract our pelvic floor, but our pelvic floor can also contract without me going pelvic floor contract. And so it's much more, generally speaking, a subconscious thing that the body is doing to respond to something. It's not you obviously purposely going, okay, contract, but the pelvic floor has the ability to do both.
Yeah. Like, yeah, I think that is, especially with vaginismus, if you think about it, like what I noticed that even if I did know how to contract it myself, it was in one of those unexpected, not unexpected, but one of those moments where you don't want to think about it, that my pelvic floor had its mind of its own. And
Yeah.
especially if we think about it in a sexual way where you go through the doctor, you got all the tools, you have a pelvic floor therapist and you know how to do all the things. But then when you're intimate with someone and there's something about to happen, that's where it sometimes says, no way, Jose, not today, right? Where it's where it had to be a whole learning of that as well. I love that you've given a description of dyspareunia next to it, because I feel there's been a lot of confusion between the two, and then also vulvodynia. Like, I think people keep coming up with, like, realizing like, oh, actually, like, is what I have, or what's it that I have? And then sometimes the word vaginismus can be muddled up in that too,
Yes.
you know?
And that's what I always say to women. It's often layered. Do you know what I mean? So your presentation and your experience might be dyspareunia, pain with intercourse, pain with smears, whatever that might be. Now, understanding all the layers of what could be contributing, what's going on with the skin, first of all, start there. Now, vaginismus might be a secondary to something like eczema, where you've had splits and that's then been sore. Therefore, your pelvic floor has responded. Or it might be driven, as we say, through a previous experience that was very traumatic or emotional. That's a normal response of the body to something in that context. Or it might be after you've had a baby and you've had a tear and some stitches, and you're then scared that that's going to hurt. Therefore, your pelvic floor is going to respond to be like, I'm not sure I'm ready for this. So I think that's the thing, it's understanding that there are layers and there are so many things that can feed into this. And though in medicine it's really helpful to have these different labels, I think as an individual, it's just understanding, okay, what's relevant for me, and that you can have, so you might have dyspareunia, but also have vulvodynia with vaginismus. You can have all of them. And though we love to be like, this is your definition, it's really understanding that the wider picture. And that's why I always work through with individuals I work with. It's like, let's look at the whole picture. Like, you can come to me and I can assess your pelvic floor, and maybe there is some vaginismus, but we need to understand why. Why is your body responding in this way? This isn't like a dysfunction. I hate that term. It's not like you've done something wrong, or this is your body being stupid, or something in your head. It's literally just understanding that our bodies respond in the same way that neck tension happens, or jaw grinding, or whatever it might be, or getting eczema on our scalp during a time of stress. Like, there's so many reasons, and we just have to work together to understand that, how that's playing out in your life, and all the things that feed into that to help you get better.
Yeah. So you already started to describe a little bit about what someone can expect. So if you think about someone comes in into your practice, so what can someone with vaginismus expect to work with someone like yourself?
Yeah. So I always say, first of all, we're going to have a really good chat, a bit like this. We're going to get to know each other. We're going to talk through what you're worried about, where things have started, what you're really struggling with now. And I will ask questions as well, because when it comes to pelvic health, even though you might think of where the vagina is being a separate whole, what's going on with your bladder, what's going on with your bowels, essentially will contribute to potentially the position that we've got to. So, for example, I've had some women who come to me for sexual symptoms, but when we dig deeper, there's a lot of stuff going on with their bowels. They've got pain when they open their bowels. They've had anal fissures. Now, this is obviously also contributing to the behavior of their pelvic floor. And actually, when we've got the bowels better, it's allowed the pelvic floor to improve, and it's made their vaginismus and sexual symptoms improve. So we may talk about things that you were like, I came to you about intercourse and now you're asking about my bowels. And I completely understand how we view those as very separate. But when we look at we'll talk about a lot of images and pictures to be like, let's look at how this is all connected. And then we can assess you. So often, predominantly, that will involve a vaginal examination. However, if you have extreme pain, or significant vaginismus, and that's not appropriate. We don't need to do an internal exam first. We can start with looking at your diaphragm, looking at your abdominals, any scar tissue, maybe observing the vulva and the pelvic floor movement, and starting gently. And then we build up from there. So depending on you, we will shape it to you. There isn't like, well, this is how I do things and you'll fit my model. It's these are our options and we'll fit what works for you. And then we make a plan. And that will often be in a very graded and structured way. But it's so amazing working with individuals who have this experience, because the results are really amazing, because they understand you. Often when they come to see us, it's the first time that anyone's made that connection to other parts of their body, or really said that there is a physical element to this, rather than just feeling like it's all in their head.
Yeah.
And making that connection, and that there's something they can tangibly do. And like any other muscle, we can retrain it can be just such an empowering moment. Doesn't mean the road is easy, but I think having a plan can just be life-changing.
Yeah. And like I literally, like, I'm a fan. I'm raising my hand when no one can see that. But I'm a fan just simply because I know how it has supported me. Like, of course, if I had to work with other things regarding like more about my own confidence around that, but it was just
Yeah.
understanding my body a bit better because I hadn't been taught certain parts
Yes.
of how it moves or what affects. But what I
Mm.
love about that, we're going to come to your book as well, but what I did love about your book, because things that I written down, which was actually what you just mentioned, because I said having a poo, like I literally wrote down having a poo and stress and body image and all these things.
Yes.
Because one of the things that or actually maybe let's talk about your book, because I can't just start throwing things in there as if I made it up myself. So you've written a book, and which is called Strong Foundations. And as I said, I listened to it on Audible, and I loved the way you spoke about it, and it was very much lovely. It was lovely to have you in my ear, let's say it that way. But then I also thought I will get the book, just because I felt for what it is I do and the people I talk to, there's stuff that I can refer back to. But what I love is that you start from the start, right? You start
Mm.
from as how we are potty trained. You go through to as well about how parents can help their kids not to have certain issues later. But then also you start talking about what you said, the poo, like your bowel movements. And of course, we can't talk about everything that you've written, but one of the things that I've highlighted was also body image, about
Mm.
how we as women
Yes.
can hold our stomach,
Yeah.
right? So can you say a little bit more about that? Just because I was like, oh yeah, I never thought about that. And then I thought about corsets, and I just thought about holding in your tummy. I thought about
Yeah.
all these things, but let's maybe include the listener in my whole little mental rant
Yeah.
about it. So
I love that.
what is it that you can you say a little bit more about body image
Mm.
and
Yeah.
vaginismus, for example?
Yeah. So essentially, again, coming back to that concept of we are one body, our abdominal muscles are really closely relatedly linked to the pelvic floor, especially the deeper layer. Essentially, you've got the inner core unit, which makes pelvic floor something called transverse abdominis, which is an abdominal muscle, your diaphragm, and also some down your spine. Now, obviously, generally speaking, there's been so much of like women need to be thin, the whole corset thing. We're meant to have these tiny waists. We're meant to be these curvy women. And so many of us are conditioned to hold in our belly, because the idea of having a rounder belly just feels completely societally unacceptable. Now, anything that becomes a learned behavior, if you're pulling in your tummy, and if anyone tries it now, generally speaking, what happens to me is my pelvic floor starts to hold as well. There is this co-contraction, this connection that happens. So you can imagine, if you go around holding your belly in a lot, the chances are you're probably going around holding your pelvic floor a little bit on all the time. This can play into what we call the tone of the muscle. So its ability, a tone is basically its kind of tension, and how much it can relax or contract. If it's almost in essence a little bit switched on all the time, and you can't fully relax very well, that can play into your experience of vaginismus. So it's very much understanding that though it's important to always look at the pelvic floor, you probably are unlikely to make changes in the pelvic floor. Even if I say to women, do some breathing exercises for 20 minutes a day, if the other 23 and a half hours they are going around holding in, straining on the toilet, stressed up to their eyeballs, not connected. It's got to be more than that. So that's where I think for so many of us, body image, the narratives that we've grown up with, the sort of 90s mentality, I think play into so much of our pelvic health and experiences. I don't just see it in women either. I see it in men as well. It's, I mean, I feel like we're uneducated. Men are just even further uneducated about their pelvic health. Most of them don't even understand they've got a pelvic floor. They just think that's a female thing. I'm like, no, like literally, skeletally, we're basically the same. We just got some clearly obvious changes and differences. But it's really, really interesting how when you start to ask these questions, or you just say to someone, do you just go around holding your belly all the time? And they're like, yeah. So I actually get people to like set reminders on their phone just for the day to say, let go, and just get them to literally like breathe into their belly, let their belly go, and let their pelvic floor go. I do the same thing. All right. We all do it. So this is no judgment point. This is hard. And I talk about it in clinic and find myself doing exactly the same thing. So it's something that we all have to work on, but we don't have to then go around being like, I'm so chill and relaxed all the time. That's also not reality, but it's just understanding within your 24-hour period, probably what your norm is. And can we just start to kind of find some more equilibrium in that?
Yeah. And I love what you said about the fact that it's a very unconscious thing at time, because if you've been doing it for so long, your body
Yeah.
is just naturally going to tense up.
Yeah.
Like I like in my coaching group at times, like when we start talking about mind body connection, like I do in a
Mm,
specific exercise, it's just for us to realize how we unconsciously are
yes.
tensing ourselves up. Or even if I'm in the bathroom or if I'm in brushing my teeth, I sometimes just have to do a check of like, ooh, I realize
Yes.
that
Love
my
that.
I'm like literally like tensing my butt the whole time
Yes.
without me knowing. Like that's just the natural me at times, where I have to be like, oh, okay, let me just let go. So I love what you're saying about, oh, you can give the breathing exercises, but it's more about the 23 hours that you're like what you're doing after, because your mind is your mind and your body is going to still be
Yes.
tensing even if you don't know. And okay.
Totally.
So yeah, so because that was one of the parts of the book, but could you tell me a little bit more about what Strong Foundations is about, or who is written
Mm.
for?
Yeah, so Strong Foundations was a real passion project. I really wanted to connect the dots for people. That was the real mission. And obviously, I could see I treat a lot of women in the postpartum community or who go through life, and this understanding that almost like pelvic health starts at pregnancy. And I'm like, no, like, yes, to be honest, in society, that's the only time we really inform women about their pelvic floor. And even then, we do a terrible job. But it's not like we then are ever with other parts of our health, like, well, your mental health comes into play in your 30s. Well, no, it doesn't. And we have to, anytime, I should say, working with someone in their mental health, we'd always go beyond it, like before maybe any problems, and understand the context. And so, me, that's what really was about. I was seeing more and more in clinic that I was having more of these conversations about, well, let's just go back a bit and see, where did this all start? When did these habits start forming? And suddenly people be like, oh yeah, I've always had a weak bladder. I've always gone for a wee. I'm like, okay, well, that's really important information. That's not just become about because you've had a baby. And though it's not written just for pregnant women, it's not, that was for me, all I could find out there was for that sort of cohort of the population. Like, what about women who don't have children? Do we not talk to them about their pelvic health? Are you only put on the map when you have children? Not at all. Pelvic health is relevant for every single person. And that for me, what it was all about. So I really tried to multi-layer it. So if you are a parent, come and read it. Let's empower the next generation. If you are having a baby, come and read it. There's loads of information about you. If you've not got any problems, you'll just learn so much about your body and you might be able to empower the next generation. If you're menopausal, you can learn about your journey and you can journal on the way. If you've got problems with your sexual wellness, come and read it, learn about your body and understand how the things might have played into that. So I try to sort of multi-layer and think any person that I've seen to date, I would love them to be able to pick it up and get something from it. And that's really what it was all about. And so far, the feedback has been lovely to help with that. So
Yeah.
for
Yeah,
me, it's
I literally I think so one of the reasons why I also purchased it just to have it is to actually quote back to it and say, because friends of mine who just recently had a
Mm,
baby or are about to give birth to, like, coming to the age of menopause, I have been
yes,
like saying, so I just read this. So I just read that. I'm one of these annoying people that will then instantly just go with your knowledge and say, here, I've got something to share
love that.
because I
Good.
read this.
Yes,
Because I think it's important, like for me as well, what I said, like I'm learning so much because certain things I didn't actually put into place. And also, like, even if you think about bowel movements and all these things, like, I'm like, oh, yeah, it makes so much sense. But it's
yes,
just that we haven't put one on one always together because
yeah,
especially if we think about vaginismus, how we're actually trying to, like, we're sometimes in such a shame phase and we're in such a,
totally.
yeah, like, self-loathing part of our bodies and trying to then dismiss it and then dissociate
Yes,
with our bodies,
yes,
where, of course, what I've said to some of my coachees as well, like, we can't necessarily, like, what are we trying to do here? Like, if we don't have a relationship with a part of our
yes.
body, we can't also help that part of the body. Like,
No.
it's like we can't help ourselves if we don't want to look at certain parts
Oh,
either.
agreed,
Yeah.
agreed. Absolutely. And
Yeah.
I think you're right. Like, how can you connect with something when you don't even have knowledge, you know? And most of us are not given this information. You know,
Yeah.
even I get lots of 20-year-olds coming through my clinic, and they're literally, I'm like, I don't want to patronize you, but I'd also just love to talk you through kind of, and they're like, oh, wow. You know, even when they're coming and being like, Claire, am I meant to have three holes because I can't find the third hole? You know, and I want always to say that there is no stupid question. You know,
Yeah.
the chances are you've never been told. So how can it be a stupid question if you've never been informed, you know?
Yeah.
And I think as a parent of a young girl, I feel really responsible to, I'm not going to teach her everything. That's not a reality, but I can teach her basic things about her body so she feels empowered. So she knows what to identify if something doesn't feel right. You know, so many women come in being like, Claire, I think this is different, but if I'm honest, I never looked before, so I don't know. This
Mm.
kind of shame that if you look at your vulva, it's like weird or it's dirty. Whereas like they can see their knee. There's no shame in seeing a knee.
Yeah.
And you know, I've got a boy and a girl, and their ability to understand their bodies is different because of how we're anatomically made.
Mm.
And everyone needs education. All genders need education. But I think as women, it's harder because we don't have such easy access to visibility. But if we're thinking about, even if we think about screening for later life, you know, skin conditions of the vulva, you know, worst case scenario, vulval cancer, if you don't know what's normal, how can you identify when something changes? And we know there's late diagnosis of these things because women are just don't know.
Yeah.
So it's, for me, it's, you know, these things sound really big, but when you just come back to the basicness of it, of just being like, this is your anatomy, it's amazing, this is how you're made. And I know there can be complexities in that as well emotionally, but just the basics, I just think we can do the basics well. Everybody can do the basics well. We don't need a degree, specialist training, or anything like that.
Yeah.
We
Yeah.
can we
Yeah.
can help with that.
Exactly. 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 So if we then think of, we just spoke about like how people, like, for example, just get the knowledge, of course, through um learning. Um,
Mm,
but if you think of pelvic health itself, like, what is it that you've seen that has been really useful for women with vaginismus within the process? So besides of the understanding the basics,
mm,
like what, like, and it doesn't mean that this is for everyone because I feel that it's
no.
not a one
Yeah.
stop shop kind of, is that the, no, okay, there's,
Yeah,
it's
that's,
not just a one way for everyone.
yeah.
But what is it that you've seen that is has supported people with vaginismus?
Yeah, so I agree. Past the kind of basic knowledge, breath work is so powerful. Understanding the diaphragm and the pelvic floor's relationship and how we can facilitate pelvic floor movement through breath is always a foundation part for me. I also often use vaginal dilators, but I think in a different way to how they're often understood. So I think obviously the name of things is always so misleading. I think women are like, oh, right, I need to literally stretch my vagina. I'm like, well, technically speaking, your vagina is super stretchy. It's got folds. The whole vagina internally is stretchy. That's often not the issue. It's often the pelvic floor, as we've discussed, which is vaginismus, that we're trying to reteach. So I would say, look, we call them vaginal dilators, but I'm not actually trying to stretch and dilate your actual vagina. I'm trying to help your muscles learn a different way to penetration. And I always say, the goal is not just to get these in and be like tick box. It's helping your body to learn, to understand, to get, as you say, into the body and understand, how am I responding to this? But they're so empowering when they're used correctly. And I think that's sometimes what I see is this kind of general advice of use dilators. Women don't know how to use them. They can actually play into the vaginismus response, because if they aren't done in an educated way, and women are just pushing more things into the vagina without education, the vagina is just like, no, I'm telling you no. And we're going, no, this is the response. This is the response. It's got to come with more insight and education to that. But so empowering and so amazing when they're used correctly. And for me, it's a lot of empowerment of the woman. So yes, there might be things that we do in clinic. We might support you with internal pelvic floor release work if it's indicated with your consent and we feel like it would support you on your journey. But for me, it is as much of, I'm going to educate you, I'm going to support you, I'm giving you the tools. This is your body and you are not broken. This is just supporting you to get back to a place of what you feel is right for you. Then if there is a partner involved, then we may bring the partner in, support them and how they can then work together once the woman feels comfortable with that, and then slowly progress from there. Now, for some, we will be working with an additional team member, whether that be a coach, a therapist as well, who will be supporting from the emotional, psychological side. Though I have some specialist training with the psychosexual Institute, can't even think the name of it now, terrible, it was a while ago, but I've done additional training, so I feel like I'm able to support, but I'm not a psychologist, I'm not a psychotherapist, I'm not a coach in that way. So again, I think this collaborative approach is often best to try and help. So I think that's generally how it would go.
Yeah. And like I feel that I can have like at least 4 podcasts with you about all this. But I'm gonna bring it back to one of the things that you said. So you started with breath. And some of the women who are gonna listen to this are gonna laugh because they know who I'm talking about. So I do something in my coaching group and I asked them at one point to blow up a balloon. And at one point there was like it's more about the balloon itself than the blowing up part. But what happened was at one point I realized that they had trouble blowing up the balloon. So we had a laugh about it and all the things. I'm like in the evening, I'm just showering and I'm like having this moment. I was like, hold on a second. What's going on there? That I managed to have a group of ladies who are not able to blow up a balloon while we're here talking about vaginismus, and also the reading that I done, which was partly your book and someone else's book, and then the diaphragm and all the things. So can you say a little bit more about the importance of breath? Because I think that when we are said, oh, you need to do some breathing, la-di-da, like we kind of like say, yeah, oh, but we don't necessarily always know why. Like, okay, I'm now reading, so I can likely try to explain it, but I wish to hear more from you about breath and the diaphragm, about the importance of breath and the diaphragm.
Absolutely. I think you're so right. And people say that to me, they're like, well, I clearly breathe, like I'm alive, I'm fine, I can breathe. And you're like, no, I get that. There's like oxygenation, survival breathing, and then there's breath within the body and how that connects. So beautiful question. So basically, yes, your diaphragm sits at the base of your rib cage and it sits above the pelvic floor. Now, I think we're familiar in the body of muscles sort of working together like a bicep and a tricep in the arm. And as one contracts, one relaxes and they move in this sort of harmony, which allows movement, which allows movement of the arm. So it's a very similar relationship. It's just that we've got organs between it rather than like bones. So it just feels, I think, a bit mentally different. But essentially, we can breathe in a much more shallow way, or we can breathe with a more deeper, what we call diaphragmatic breath. And when it comes to our pelvic floor, the diaphragm really needs to move in order to facilitate the pelvic floor breathing. And generally speaking, we're all quite stressed. We're all kind of like rushing. And actually, when you think about it, a lot of us don't take really nice, deep breaths. Now, I think it's multifactorial in how breathing helps those with vaginismus or those with pain. I think it's potentially a nervous system calming thing as well as a physiological structural movement thing. I think there's kind of two benefits. But essentially, when you do a diaphragmatic breath, your lower rib cage needs to be moving. So more than your upper rib cage, kind of where your breastbone would be, it's much more in the lower ribs, which if you actually start feeling your ribs, they're really low down. They go down a long way. Your lungs are big old things. And so if you basically put your hands around your lower ribs and take a deep breath in, you're looking to expand those lower ribs out, but also let your tummy to relax. So don't pull your belly in, let your belly come out. As you take that breath, you can also think about letting your pelvic floor go, visualizing the vagina opening, and you might start to feel a bit more pelvic floor movement. But essentially, yeah, as your diaphragm, if you breathe in, your diaphragm descends, your pelvic floor naturally lengthens and moves down and relaxes. And as you breathe out, the diaphragm recoils, and basically your pelvic floor recoils with it. So that's how there is such a connection. But it's different breathing to just in and out day-to-day breathing, as I'm doing now as I talk to you, so I don't pass out.
Yeah. Like, is it true? And I'm just going to see if I could recollect this correctly. This is not what I read in your book, but if we think about taking short, shallow breaths, so when we do it from the chest, right, they were kind of like tightening the pelvic floor.
Could be. I'd say it's a tricky one because we don't have enough research to prove it. But theoretically, I would say could be, and it could be through different mechanisms as well.
Yeah. Okay. Like, one of the things that I always thought of, like, when we, like, now I realize, like, when I think of, like, I always loved singing and singing lessons. And if you think about it, when you do singing lessons, you use your diaphragm. And but
Yes.
you will have to learn how to use your diaphragm when you do singing lessons, and then you learn how to take those breaths to keep your, like, to be more powerful with your voice, etc. And I think, like, oh yeah, that was such a good, like, when I read it in your book or when we're talking about it now, like, to really see of, like, oh, the difference between the high up breathing versus, like, be like having your belly go up and down. And like, when you see babies, you can see babies using their belly naturally as well, versus when we are stressed, when we're like, like really short breaths on top of
agreed.
but then the other part, so, because, like, I've got all the questions but also no under time. Dilating, thank you so much for clearing that up, because oh my bloody bleepity bleep, I am okay, sorry people, I'm getting a little bit annoyed at the dilation process, where sometimes people are being given dilators without proper instructions. People buy dilators without proper instructions. And as you said, it can also sometimes work against you if we don't know what we're doing. Like, if we haven't been able to penetrate, why are we all of a sudden trying to stuff something in against, like, it just, like, for me, it does not make a lot of sense. And I can't go on all the websites that people are like, for some people it might work, for some people it might not, but it doesn't mean that dilating is the answer to everything. Like, I feel that what you're saying is true. Like, if it's done properly, if you understand what the reason is that you're doing it, if you haven't been given just a random dilator through your GP without any description, then make sure you first find a specialist, like a pelvic health therapist, who can help you understand what it is that you're trying to do and what it's for. And as you said about stretching or no stretching, like, I read so many random things. It's like, stretching the vagina, where, like, but we can, no, but we can, like we can poop out a baby and it stretches out a whole bloody child. Like, you know what I mean? Like, it's not going, that's not what this is about.
Misleading.
It's very misleading.
Totally.
Yeah.
Totally.
So thank you for that. Sorry, I
Oh,
interrupted.
my pleasure. No, I was just going to say, I just think it's like another way of just like playing into women not understanding their bodies, and it's like very disempowering. So I think that message is so, it really blows my mind how a woman can come and consult for pain with intercourse, can consult for pain with intercourse and be given like a plastic dilator and be like, there you go. How on earth do we view in this day and age that is a solution? It just is so far beyond my understanding. So yes, I think we've got a long way to go, but there is, and then there's more and more free resources. There's so many ways to getting that support now. But yeah, don't be afraid to push back and
Oh, we're losing
say,
reception a little bit. I'm sorry.
oh,
No, you're back. You're back. I can hear you, but I can't see you. Oh, you're back. You're back. You're back. You're back. Yes, I don't know what's up. One of the things that you said is like what I understood through the parts which was missing was what you said. Don't hesitate to kind of find second opinions or to get more resources or
yes,
get more
totally.
information. Exactly. And because I think it's so important. I think we're both very passionate about supporting others, but we just want it to be as well
Yes,
in a safe way. And I think that it's the knowledge of your
totally.
body, which is something that
Yes,
what you've described so well today and in as well in your book. Um, but because I know that there's going to be a patient coming to you soon, I'm going to go to our last few questions. And just to wrap things up in a way, I've got a few questions just as an empowering way. So, if you think about one myth that you wish to debunk about vaginismus, what would that be?
mm, yeah, great question. I would say it's not in your head. It is more complex than that. It's all body. It's an all body thing.
Mm, mm, mm. And it's so interesting because people said, yes, but they also said it's in your head. But as you said,
Nothing can
it's,
be.
yeah, because it's all one,
It doesn't
right?
neurologically work like it's not like things happen in the brain and stay there. Like we're a nervous system. There's
Yeah,
constant communication between the gut and the brain and the gut and
exactly.
it's just way more complicated than that. So if anyone said that to you, it's just doesn't actually, it's not how it works. It's not how
Yeah.
it works.
Yeah. It's not like because your body is all of you, including your
Literally,
brain. Yeah, exactly.
literally.
Exactly. So if there's one thing you wish people would know about vaginismus or a pelvic floor, what will that one thing be?
Mm. That your pelvic floor is dynamic and responding all the time. And we need to understand why your pelvic floor is behaving in that way and support it to learn a different way. So it's not broken, it's just learned a different way.
Amazing, amazing. And if you have one empowering word that would say, our pelvic floor is
The most amazing muscle in the world.
woohoo! I love it. I love it. I love it. So
I'm
if
biased though, but
yes, very true. But I also want to agree with you because the more I'm reading about it, the more I'm like, hold on, it is very it's amazing because it's not just one. It's not a pelvic floor. It's like pelvic
exactly.
floors. It's like a whole
Exactly.
part of you that keeps you up
Oh,
and makes sure
yeah.
that you go and poop and pee and have been able to enjoy sex if you want to have penetrative sex too, right? So it has
Yeah.
all the things. Um,
It's just
so
amazing.
but if someone wants to find you, if someone wants to connect with you, how can they best reach out to you?
Yeah, so probably via my website. So it's clare-bourne.com. Loads of information about me, kind of different options. I now got an amazing team who do different like appointments as well. So I know when it comes to intercourse and sexual stuff that it can be really scary to come to an appointment, but sometimes a telephone consult, a chat, a virtual can be a really nice way in. So we really try and make it as approachable for everybody. But yeah, probably via my website, drop me an email through there. And, if I don't feel like I can help you, there will be someone else. And maybe you live in a different area to me. Like, don't let anything be a barrier. Just reach out and we'll work together to find the solutions for you.
Yeah, amazing. I will also put the details, of course, in the show notes. And of
Thank
course,
you.
I will also put a link, or actually, I think they can find it on your website, like the book Strong Foundation
Yes.
Why Pelvic Health Matters, an empowering guide to understand your body. But
Yeah.
I just really, really, really want to thank you because, we had to cut it a little bit shorter today, but I am just grateful for all the things that you said. So thank you, thank you, thank you.
Thank you for having me and for all the work that you do, because it's a real team approach, isn't it? To support
I think, yeah, I feel so too. But and I also want to thank you, listeners, for listening today. But yes, go find Clare, or at least read up on it, or find someone that's in your country that is the same as her.
Yes.
But like, make sure that you connect and at least learn, keep learning. Thank you. This was the VME podcast, Let's Name It Not Shame It, with Audrey Cairo. Don't hesitate to reach out or to connect on Instagram on Let's Call Her V, or find any other details about coaching and workshops on audreycairo.com/VNme. Please know that while podcasts can be a great source for information or stories, this is not a source or substitute for professional medical advice, diagnosis, or treatment. So always consult a qualified medical professional for any medical support. And while it might be scary or difficult sometimes, don't forget to ask for what you need. You got this. Thanks for listening.